Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines Bryant. We're in the midst of the holiday season, but for some, the holiday season is not a joyous time. It can lead to stress. It can lead to depression. So our guest today is Dr. Kimberly Brooks, and she's going to talk to us today about the holiday blues. Welcome. Thank you so much for joining us.
Thank you for having me.
Can you give us a definition of what is the holiday blues?
So holiday blues is not a clinical term, but it is a real thing that people experience during the holidays. It has to do with feeling overwhelmed, stressed, and just kind of down around the holiday season time.
What's the difference between the holiday blues and the seasonal affective disorder?
So seasonal affective disorder is an actual clinical diagnosis and has to do with people having difficulties, most often during the winter season, with clinical depression, so difficulty with appetite loss or increase, difficulty with sleep, either falling asleep or staying asleep, difficulty maintaining their regular, normal, pleasurable activities, an actual clinical diagnosis of depression around the winter season is what SADS is usually associated with.
How do you know you don't have both, or can you have both?
Oh, you could definitely have both, yeah. But the distinction, I guess, has to do with sort of duration and intensity. So if it's something that lasts throughout the winter season, not just during the holidays, it's more than likely something more akin to SADS than just holiday stress.
Why is it that the holiday season brings up a lot of issues for people? I guess maybe because when you're dealing with family, as you do more,
Right.
most people do more during the holiday season, you tend to kind of start remembering things of old, and
Right.
that might bring on some stress as well.
I think it can be related to a number of things, that being one of them, just the complications of your history and how those complicated histories come up for you when you're around the people who have been in your life and been involved in those complications. But it also has to do with people sort of overcommitting and not setting limits and not being able to say no.
When you are dealing with the family issues, what do you do? Because you can't just X your family. How do you go into that with more preparation? I know, for example, I come from a family of six, 7 children actually, and I'm one of the babies, one of the younger children. And as we get together for the holidays, you tend to fall back into that role.
Right, right. You're still the baby.
Of the baby.
Right, right, yeah. I think one of the things that can be helpful is, again, sort of setting your expectations at a reasonable level. And if your expectation is that people are going to treat you differently and they don't, then you're going to be upset, and that's going to be stressful. If your expectation is that people are going to probably treat you the way they have treated you for the last X number of years, then you're not as likely to be as stressed about it, and you can prepare for it.
How do you deal with those triggers, or how do you know what those triggers are?
That can be hard because a lot of times I think those triggers are sort of buried or unconscious, as we say. But for most of us, we know certain people in our family have an ability to push our buttons in a certain way. So knowing that those people are going to be either at a particular gathering or present for a particular amount of time, and setting your expectations again at a reasonable place can be really helpful to prepare for that.
How do you plan ahead? Another thing we find is we procrastinate during the holidays with getting things done, and you can procrastinate mentally.
And I think people procrastinate often because, again, sort of going back to expectations, they have an expectation of things being perfect. And if you can lower that expectation and understand and know that, one, there's no such thing as perfection, and really set your expectations at a reasonable level. The table doesn't have to be perfect when the family comes. The house doesn't have to be immaculate when the family comes. Then it can, I think, really help with that.
How do you prevent from overcommitting? Sometimes you want to make sure that if you have children, that your children have everything, or that your loved ones have everything.
Right.
How do you prevent from going overboard?
So you can go overboard financially, and you can go overboard with time commitments. So there are different ways to handle, I think, those two different things. In terms of time commitments, I think it's best to really put on your schedule time for yourself during the holidays, and really put it on your schedule so that when someone asks, can you attend a party, and you look on your schedule, you can legitimately say, actually, I have something planned for that time period, so I can't commit to that. When it comes to financial obligations, I think, like many people have said, having a budget for your finances for the holidays is extremely helpful, and sticking to that budget.
How do you say no?
Saying no is difficult. I think letting people know, again, that you have limits is part of saying no, and being clear about what those limits are, and sometimes even saying things like, I know this is hard to hear, it's really hard for me to say, but I can't attend, or I can't help, or I can't commit.
That's a pretty tough one.
It's
That's
a hard
pretty
one.
Tough one. If you know that this is something that you experience year after year, as we just discussed, we can become prepared for it in several different ways. One of those ways to prepare can be mindfulness. How do you begin to practice mindfulness?
And I think that's, I'm glad you said that, because mindfulness really has to do with acknowledging and recognizing. So acknowledging that something is difficult, and then recognizing that there are options that you can choose. So recognizing or acknowledging that it's difficult to be around Uncle Bob, and I have options. I can be around him for 10 minutes and then excuse myself, or I can sit there and suffer and be miserable.
Now, we're going to do a show on mindfulness at some point, so I'm going to ask you to come back to do that show. But for the people who don't know what mindfulness is, can we go over a little bit what does that mean to be mindful of your surroundings, mindful of your situation?
And so it means just that, being aware and noticing, and actually acknowledging that I'm feeling stressed, noticing and acknowledging that I'm in a place where I'm uncomfortable, noticing and acknowledging that feelings are coming up for me that I felt before, and I'm not sure how to manage those feelings.
Will getting out of the house help as well? Just as you just mentioned, just taking some time to do some of the things that you want to do, that you like to do, and thinking about yourself instead of everyone else.
Right. It's kind of like the airplane analogy of putting the mask on yourself first before you try to help other people.
Great analogy.
So if you're not, and I work with moms a lot, if you're not okay, you can't be okay with them. If you're not at your best, you can't do your best. So taking care of yourself has to be a priority. Yeah, so putting that time on your calendar so that's actually something that you've scheduled. A walk on Monday at noon. Actually putting it on your schedule, on your calendar, so that you see it and it pops up, just like every other appointment that you have, is really helpful.
What are some of the other things? You and I, before we got on camera, we were talking about some things like running, some things like doing yoga, become active. Most people, as a yoga instructor and as someone who owns a yoga business, a lot of times people stop exercising and stop doing those things during the holiday because they get busy with other things. How do we, like you said, make yourself put that on the schedule? Exercise, fitness, healthy things. How do you make yourself put that on the schedule?
Well, I think just sitting down every day when you're doing your schedule, and whatever else you have to schedule, whether it's work or appointments for the kids or appointments for yourself, when you're making that schedule, you also schedule that time for you to do those things that are re-energizing and nourishing for you. So scheduling it along with your other appointments.
A lot of us nowadays are very much involved with social media. So we go on Facebook and we go on different sites, and sometimes people will see what other families are doing. Hey, this family is doing a big celebration for Christmas. I'm only having 2 people. What would you say about making sure you monitor your social media, meaning be careful not to compare your life to other people's?
Right. In general, I try to advocate with my clients and patients not to compare yourself, because almost always you come up on the short end of the stick when you do those kinds of comparisons. But it also has to do with, an aspect of mindfulness, which has to do with gratitude and thinking about the things that you do have in your life that are important and that are good for you, and really focusing on those things and not focusing on what you don't have, but focusing on what you do have.
I am a huge advocate of the whole gratefulness thing, the fact that you woke up in the morning.
Exactly.
Just
you have breath.
Exactly. There are so many things. So you can make you can actually make a practice out of that alone.
Yeah, and I do have clients who do what we call a gratitude journal. So every day, for the first 5 minutes when they wake up, they write down something. Could be something seemingly as meaningless, although it's not, as I woke up this morning. That's something to be grateful for.
And that is absolutely not meaningless. That's everything.
Right.
Because my mother used to say all the time, a lot of people did not.
Somebody didn't wake up today. That's right.
Can you start something like that? I think it would be a good idea to start something like that right after Thanksgiving.
Oh, yeah. Yeah, absolutely. A lot of people do that right at Thanksgiving. They start their gratitude journaling around that time and continue it through the holidays as a way to manage through the holidays. And I think it can be very, very helpful.
What does journaling bring out of you?
I think it brings out different things for different people. It can bring up difficult things for some people. So sometimes journaling can lead to raising issues or kind of bringing up issues you haven't thought about in a while, which can then be a positive thing in that you find someone to help you sort of process and work through some of those issues. But it can bring up different things for different people, for sure.
Would you suggest people go to counseling during the season if they need to?
Oh, absolutely, absolutely. I think that, again, because a lot of the difficulty and stress that people feel over the holidays does have to do with sort of history that's brought up by being around family, that a lot of times being in therapy around that time is very helpful, because then you can sort of talk through and process those difficulties and approach them in a different way a lot of times.
One of the common things we do during the holiday season, I know when I go to my other job, when I come in during the holiday season, there's a table full of food. Table full of cakes and candies and all the things.
Calling you.
Yes, they're and it can be a stress reliever. How do you work with that? Work with, not overdoing it during the holidays?
Yeah, I think one of the ways to not overdo it, again, goes back to kind of what I was saying about perfection. Not insisting that you not have anything. So having a little bit of everything is probably okay. It's when you place really severe and unrealistic restrictions on yourself that people tend to overdo it, whether it's overeating sweets or anything else. But allowing yourself to have, one cookie, half a slice of pie, that helps.
In moderation.
And everything in moderation. Yeah.
As we approach the new year, as we approach the coming year, it can be sort of anxiety filled. What will this year hold for me? What will this new year hold for me? How do you prepare yourself for that? What's the best way to get ready for the new year?
A lot of people advocate not doing a resolution list, and I tend to agree with that, because it can be for the vast majority of people. By the end of January, the list is out the window. So, and then they're discouraged and depressed, and I didn't live up to my expectations or someone else's expectations. So again, it comes back to moderation and limits, and setting realistic limits, and doing what you can with what you have. So if it means that you're really wanting to get healthier, so I'm going to change my eating habits by drinking skim milk instead of whole milk, that's a start. I'm going to change my health habits by going for a walk for 5 minutes once a week. It's a start, not I'm going to lose 20 pounds by the end of January.
So make those small changes. Last year, I made the New Year's resolution to take off some weight. I was telling everybody how to be healthy and how to be fit, and I wasn't. And it's hard, like you said. By the end of January, you're ready to throw it all out the window.
Right.
How do you maintain? How do you continue if you do make that goal, you know, rather than frustrate yourself? What's the best way to continue on with your goal? Or if you mess up, because we're all human.
Exactly.
And you may mess up. How do you get started again?
Goes back to the gratitude and the not setting yourself up for perfection. So being grateful and the mindfulness, acknowledging what seem to be small steps and being grateful for those. Well, maybe I didn't lose 10 pounds. I lost 2 pounds. That's better than nothing. So you lost some weight. Maybe I didn't walk every day, but I walked 3 days. So acknowledging the successes, really, because you can't move forward without acknowledging those successes. If you're sort of constantly beating yourself up, you're just doing that, pushing yourself back instead of moving forward.
With the seasonal disorder as well as the holiday blues, when do you find that people start to sort of go back to normal or start, you know, feeling better?
With seasonal affective disorder, interestingly enough, most people associate it with the winter months, but there are people who suffer from that during the warmer months as well. They're miserable during the warmer months. I think we were talking about our preferences for winter and summer earlier.
Yes.
And there are some people who just really have a hard time in the the summer months. So it depends on what is difficult for you as to when you see people coming out of that, and it also depends on kind of how they're addressing it or what they're doing to deal with it. So some people may come out of it more quickly with winter blues than other people because they're working on it as opposed to kind of just sitting with it and not doing anything about it. People who tend to process it, see somebody, see a therapist, are going to come out of it sooner.
So is it a duration thing? If you find yourself in the spring and you're still feeling that way, are there other issues going on?
More than likely, yeah. And that would be the point at which I would advocate that they see somebody, for sure.
Are there vitamins, for example, that you can take to help deal with vitamins or medications? Or do you suggest a combination of therapy and...
Absolutely, yeah. That is the gold standard, is therapy and medication if someone is dealing with depression or seasonal affective disorder. Most practitioners would not advocate just medication or just therapy if it's a clinical depression, and SADS is a clinical depression. So some form of medication and therapy is the ideal combination.
Something I've always heard is a lot of times when you're going through those difficult situations and you start to feel a little bit better, then you stop all the good things that brought you to where you are.
Right, right. And I see that a lot in my practice. Someone will be on medication for, you know, a couple of months or so, and they'll, I don't think I need to be in therapy anymore because I'm feeling fine. I don't think I need to take the medication. The connection doesn't seem to happen. You're feeling better because you're taking the medication and you're coming in. And almost always they're back within a few weeks or so.
So how do you deal with that?
How do I deal with it in terms of...
to make sure that people know, hey, you're feeling better because you're doing this, and if you stop doing that, then you're going to end up right back here.
Where you were. Yeah, yeah. I pretty much say that. That you're feeling better because you're compliant with your medication and you're working through your issues and you've resolved some things, and you're not quite, if this is the case, you're not quite at the point where I think you're ready to end therapy or not take medication. It's always your option, but more often than not, if it's done too early, you're just going to see a reversion back to.
And for the people who are looking at us right now and thinking, I got some of those things, or I'm feeling some of those ways, what again are the symptoms?
So with holiday stress, holiday blues, you're seeing a decrease in your usual enjoyment of activities. So you're not as interested in going to the gym as you were before. You're not interested in going to the holiday parties. Your appetite may change. You may be sleeping more or less. You may see some weight gain or some weight loss. Those are symptoms. If they continue beyond the holidays, then we're talking more about a clinical depression and or potentially seasonal affective disorder.
And you just, as you said earlier in the program, you can experience both.
Oh, sure, yeah.
Now, before I came here in my research on this, some believe that it's one and the same, that they are one and the same. What gives you, or what in your background suggests to you that they are two completely different?
Because there are some people who, again, after the holidays are over, are still experiencing the symptoms of SADS with the lack of interest, or what we call adhedonic symptoms, lack of interest, fatigue, appetite changes, sleep changes, weight changes. Those things continue after the holidays are over. So beyond January, beyond February, and it's still cold and wet, and they're still experiencing those
So
things.
when someone walks into your office, do you know? Can you pretty
Whether
much
they are
diagnose
just
whether it's just a holiday thing, just the stress of dealing with the holidays, your children, your family, your job, or whether it's something else? And I'm sure after 20 years, you're pretty clear.
Typically, yes, because I do a pretty extensive history taking when they come in, and if there's history prior to the holidays of those symptoms, then that lets me know that it's probably not just the holidays. The holidays are particularly difficult, yes, but it's not just the holidays.
And it's something that can happen to anyone, I'm sure.
Oh, yeah. Yeah, absolutely. Because, and I say this to my patients all the time, there are no perfect families, so there's no perfect people. We all have stuff.
We all have stuff that we're dealing with. What's your biggest suggestion as we wrap up the program? What is your biggest suggestion for people who are going into the holiday season? You may find that level of stress from your job, from your family. What's the best way? We did discuss journaling.
Right.
We discussed being physically active. We talked about making sure that you monitor how you feel about certain social media situations, and that you don't have the perfect family. You'll always find a family that's doing better than you. What are some other suggestions that you can give to folks who are walking into the holiday season?
Well, I would reiterate scheduling time for yourself and actually scheduling it, not just sort of in your head thinking, oh, I need to go for a run, or I need to go to have coffee alone, but actually scheduling it on your phone or on your calendar.
Coffee alone, that sounds good.
Doesn't that sound good? Actually scheduling that alone time, or whatever is going to be nourishing for you, whether it's alone time or time with friends, but really scheduling that I think is important. And thinking clearly about what sorts of limits you need to place around finances and around social obligations.
Now, you're local here in the
Yes.
Bowie area. You've been practicing here for a while. Your specialty is what?
My specialty actually is what's called infant mental health, and which sounds strange to a lot of people. What would an infant have to be concerned about? Unfortunately, lots. So I see children birth to 3, but I see kids up to 5 or 6, and also pregnancy and postpartum issues. Those are my specialties. I happen to see adults with a range of other issues as well, but those are my specialties.
What would qualify an infant to be seen at? What would the signs be that an infant needs to see a psychologist?
So they actually have all of the same feelings that we have, and just don't have the words to express it. So an infant can be anxious, an infant can be depressed, an infant can be traumatized. So there are lots of things that they can experience that they just don't have the words to express, and that people who are trained in infant mental health have the skills and ability to see.
I'm sure that's another show that we can do at some other time. But how would you treat an infant? Of course, the treatment would be different from an adult. So you have to learn certain techniques in order to deal with an infant, I'm sure.
Yeah, so there's play therapy, there's parent-child therapy. It depends on what the issue is. So, and with regard to infants, often I'm seeing them with a parent, most often a mother. There are unfortunately things that aren't talked about that much in our culture that have to do with sort of mismatches in temperament between moms and babies. So you have a baby who's very high energy, very needy, and a mom who's sort of low energy and laid back, and the demands of this child are just really difficult for her, and that can interfere with the attachment.
Very interesting. Do children go through holiday blues?
Especially children who are in impoverished situations, yes. Children who are neglected, children who are abused, children who are in shelters, children who, but even children who are in more privileged homes, you wouldn't think, can have issues with neglect and depression because mom and dad are working from what I call can't see to can't see. So they're never home. And the child, and that's what children need, is time. That's what they need the most. And when they're not getting that,
how does it manifest?
In some of the same ways, but with children you often see what we call an irritable form of depression. So they're more easily frustrated, they have difficulty sleeping often, but the same things with eating, same things with weight gain, weight loss. So some of the same symptoms, some differences have to do with irritability and loss of interest in activities.
And the interesting thing with children, they don't have that level of self-awareness that we have.
So they aren't going to sit down and say, by the way, Mom, you know, I really wish you'd spend more time with me. It's a little depressing.
Exactly. So how would a child be treated? Pretty much the same way? Or?
Pretty much play therapy. So kids between the ages of 2 and 5, I see them in individual play therapy. So play is a child's natural way of expressing their thoughts and feelings, and it comes out in their play. If you've ever observed a child playing with their dolls, for example, a little girl playing with her dolls, she will more often than not mimic and say and do things that mom has said and done. And so if there are things that are going on that are troublesome for kids, it comes out in their play in the same way.
And the treatments for children would be more attention from parents, or how
well, the play therapy is part of the treatment.
Okay.
And then at times I do, again, depending on what the presenting problems are, I do what's called parent-child therapy. So I see the child and the parent together in play therapy, and it's kind of helping the parent understand how to be sort of more supportive of their social-emotional development and their needs, and how to address their issues, because that's really the person that is most important to that child anyway.
Okay, I was a little confused there. So in order to diagnose, it's the play therapy, and then treatment as well is...
Yes, play therapy is a part of the diagnosis, and then also part of the treatment, yes.
Okay. Dr. Brooks, one thing we didn't touch on was holiday travel. A lot of people will be going through the whole hustle and bustle of traveling this holiday season to home or maybe a vacation spot. How do you deal with, like I said, the hustle and bustle of holiday travel?
And absolutely, with recent events, it's even going to be more sort of intense in terms of security and that kind of thing. So planning well ahead of time, especially if you're traveling with children, and giving yourself more than what you think you need in terms of travel time, so that you're not rushing to get there in the first place. You don't arrive there already flustered. So giving yourself plenty of time to get there. Also making sure that you have all of your documents ready and at hand, boarding passes on your cell phone, or if you're, you know, old school and still want a paper boarding pass, making sure you have all of those things in one place so you're not sort of fumbling for them, so an envelope with all of that in it. A lot of times with kids, you can order online, not order, but make arrangements online for lots of things to be available to you once you get to your destination, so you're not having to carry so much with you. So whether it's a car seat or a stroller or a crib or a bassinet, you can order those things ahead of time and have them waiting for you when you get there. So it takes the stress out of having to carry extra luggage and baggage.
Thank you so much for joining us. We've been talking to Dr. Kimberly Brooks, and we've been talking about the holiday blues. We're in the midst of the holiday season, and sometimes the holidays are not joyous for everyone. Thank you so much for joining us. I'm Stephanie Gaines Bryant. This is the Sisters for Fitness Wellness Show. Have a great day.